Today, my guest is Dr. Katarine Holewa. She's working in one of the health units here in Victoria, in British Columbia. I was planning for quite time to invite one of the health practitioners, and I wanted to do that for two reasons. So the first one is that healthcare practitioners are actually the ones who are here to take care of us, to support us, help us, and guide us through the difficult times. And we all know that they're showing up for us in the last 3 months more than ever. We treat them and we appreciate them as our heroes. So I wanted to talk with one of them and just to give a space for them to provide us with some valuable advice we all need right now. And the second reason is I wanted to hear their side of story. During my life, during many life experiences, I've learned that in order to collaborate, we need to see and hear and understand the other side. And I always want to learn more about the ways they were showing up and they are still showing up for their patients, especially in this type of situations. So today I'm not having a doctor, like Katarina is not a doctor of Western medicine, but something we call complementary medicine. She's a naturopathic practitioner and registered acupuncturist. So let's start by asking her to provide us with more details about her profession and how it affects people's lives.
Hi, thank you, and thanks for having me. I guess with your first question, as a naturopathic physician and registered acupuncturist, my primary goal is focusing on the overall health of my clients. We work with nature to optimize health using the most natural approaches, the diet, some supplements, exercise at first, and we can always go to stronger methods later. For example, if we need to use pharmaceuticals, that is in our toolbox, but we prefer to use the most gentle methods first. We see the human body as one that encompasses physical, mental, and emotional realms. We're not broken up into little pieces, and all of those realms need to work together in order for true health to result. Unlike some providers, naturopaths don't see themselves as the ones who are going to fix you or fix this one little problem in you. I'm not going to fix your stomach ache, or I'm not going to stop your skin from itching. Instead, we work with our clients to delve into why is your stomach sore, and how is this causing you discomfort in your life, or why is your skin breaking out? What are the circumstances in your life that are causing your skin to itch or break out, and how can we change that to stop it from happening? We look at the whole person, so physical, mental, and emotional realms, and how they interrelate, and how in or out of balance a person is. That's really important as we strive for balance. We don't want any too much or too little of anything. It's really important to consider also that it's not only a person's individual circumstances that can matter, it's also what's going on in their environment, with their family, with their friends, and you know, in a pandemic, there can be a lot that's affecting a person. Something I mentioned a second ago was a key aspect of naturopathic medicine, as well as acupuncture, is we're not there to fix you. We're there to provide you with the tools to fix yourself. My job is to help find what's out of balance, and then help you realize what it is that you can fix in your life. And this provides you a really unique opportunity of self-healing, as well as healing for your entire family. We want to give you the strategies to keep yourself healthy now, so that you can keep yourself healthy in the future and not have to keep coming back and seeking treatment for the same thing. I guess another way to put that is that doctor is teacher, and I take that really seriously, and I'm here to share my knowledge and teach people how to heal themselves and then how to stay healthy.
Amazing. I love that. And I remember our initial conversation before I became your patient, where I had to answer the questions about my current life situation, where I was asked about my friendships, did I have any changes in my life recently? So I love that approach because it gave me the sense to think, oh my God, maybe I'm experiencing this because it's related with what is going on in my life or how much I'm dealing with currently, or because I was lonely back then. So I really love and appreciate what you do. So thank you so much for this. I want to know, because we are gathering because of the coronavirus situation, and therefore I would love first to ask if you can tell me what was your personal experience in the first several days of self-isolation?
So, it was very difficult. It was very surreal, I guess would be the best way for me to say it, when it first hit. Being self-isolated and having to change routines that we've had in place for 20, 30 years, everything from going and picking up groceries to going out for coffee with a friend and being told that you can't do any of this stuff anymore. And then, of course, there became the added changes of certain places requiring masks and me not being able to go to work. It was very surreal, and it was very uncomfortable. I found it a very difficult sensation to be seeing those around me as
Right.
infectious, and we had to stay away from each other. We're a social species, and it goes completely against our nature to do these things. At the same time, I had and continue to have enormous respect for our health authorities. And so in particular, Dr. Bonnie Henry, who's our provincial health officer, they put forward guidelines, and they explained exactly why and how it was affecting us. And following those guidelines and seeing how they were working and seeing that everyone else was doing it made it a lot easier for me in my personal life to follow them, and then to get along with that. And also personally, I guess it just gave us a chance it forced us to just come within ourselves and change our lives.
Knowing why usually brings us that sense, like, okay, this is not forced, this is for a reason.
Yeah.
This is for a reason. So in a sense, you're calming yourself, and then you can self-regulate. But how is this sudden change, how did it affect your professional life?
Yeah, professionally, well, we had to immediately stop seeing patients in the clinic, and being a naturopath and acupuncturist, my patients come in, they see me, I do IVs, I do acupuncture, I do assessments, and people, we were suddenly told we weren't allowed to help people anymore. And as a naturopath, that's one of my pledges is to help people and to continue to give them care all the time. So that was very difficult. On a positive note, we went miles ahead in technology in terms of telehealth. And so we immediately switched our platforms to telehealth so that I could continue to see those people who really needed to see me and who had either ongoing concerns or had new concerns that developed because of or in relation to COVID. So that was good. It changed a lot. It made us really rethink how we work. So instead of me doing a lot of one-on-one treatments, I had to do a lot, even more education than I was already doing, so that people could find the means to take care of themselves. Those would be the biggest changes, professionally.
I want to say that I have here printed your email, and I want to say I was checking yesterday. It was Tuesday, March 17th, when I got your first email, and I was still working. I checked yesterday, and Tuesday was my last working day. And I was surprised to get your email with thorough explanation, what I'm supposed to do, how can I reach you, You mentioned that you're offering for phone or Skype consultations, that supplements are available, that you can ship them to us directly. And I want to read something from this because I felt supported. I know that first 2 weeks were for me the scariest, because suddenly I was checking my child and then like thinking like who was from my coworkers were traveling a week before, and I was thinking maybe I have it, maybe I caught it. So it was a fear mode those first 2 weeks for me especially. And when I got your letter, that was, you call it as a note of support, I would love to read this. You said, "This is a stressful time for everyone, emotionally, mentally, physically. I'm working with many of you on issues that don't need and often shouldn't be put on hiatus due to the current health climate. Acute illness, fertility concerns, weight loss, mental health, cancer, these medical concerns don't take a break. So your health doesn't need to suffer while we are taking extra precautions. In a virtually inclined world, these options are available and we should take advantage. Together, we will make it through." I want to thank you publicly for this letter because I felt supported. I felt more secure after knowing that you are not unreachable and I can always rely on your advice or any information or supplements that I need for me and my family. So thank you very much for this.
I'm so happy that it was helpful. I did feel a need to reach out and at least touch base because there was so much, you can't go here, you can't go here. And to lose your contact with someone who's been helping you, I'm very glad it was helpful to you.
Yes,
and
very, very much. And you actually, that was 17 and 3-4 days after we got a new letter. And that was like all the explanations I've got in this is a flyer from government, and everything I've read there about not to touch your eyes, avoid contact, wash your hands, take care of especially the elderly. I had everything here, so I was completely like prepared for the situation. In a sense, I could, even without TV, I didn't need TV or radio. Just this email put me in the right box. Like I need.
I hear that.
No. Thank you so much. Thank you so much. Now in coronavirus, it's June. Right now it's June, and coronavirus situation, at least in Victoria, is different, much different than March. We have reopened a lot of stores here and health units. So I would love to know what is right now happening in your office, what people can expect when they come to, for example, see you for an appointment.
So we reopened on May 19th when we were allowed to. We actually started preparing for that almost right when we closed. So we started preparing by getting extra masks and getting extra hand sanitizers and marking out the floors. What people can expect now is that before you come in, you'll get a pre-screening questionnaire just to make sure that they have no symptoms. Our practitioners have staggered their working days, so we have tried to keep very minimal staff each individual day. I work Monday, Wednesday, Fridays. Other practitioners work Tuesday, Thursdays. This not only minimizes the amount of doctor interaction that's going on, but it also minimizes how many people are in the waiting room, because that's another source of contact. We've removed most of the chairs from our waiting room. All of the magazines are gone. All of our flyers are gone. When you come in, I require everyone to wear a mask, including myself. This keeps not only me and you safe, but it keeps all of those in our bubbles safe. And then now that we're open, we are having one-on-one consultations. Our chairs are 6 feet apart. We're wearing masks anyway, just because you never know. And it's really been a very easy transition. And I've had feedback from clients I've seen in clinic who felt very safe coming in. Additionally, I am continuing to do telehealth and video conferencing for those people who either are afraid or who don't feel like parking downtown, or who feel like staying in their pajamas. That way I'm here for you, and I'm going to continue doing that long term. So that's been one benefit, right?
Yes.
We've really increased our technology.
Yes, yes. And a lot of people are now using in
Yeah.
like if you can choose, you have options now to stay at home or come to visit. That's good. I was in your office recently, and I was following those steps on the floor. I had a mask. I was maybe for 5 minutes, but everything went smooth. Can we go back a little bit? Because although in Victoria, I have to say again, it's less stressful than in other parts of Canada or some parts of the world. Coronavirus is still there. It's still there. It still affects a lot of people. And I would love to ask you, during this self-isolation, during the 3.5 months, what were the main health concerns people were addressing, people were experiencing? Can you give us, like, I want to know what was going on and how people reacted to this stressful times.
Beyond ongoing concerns, the two things that came out the most strongly would be immune health, and that was huge, and that makes sense, but I'll go into that in a little bit. And also mental health. So touching on immune health, people have been very concerned about coronavirus, but they've also been very concerned about just getting sick anyway, because nobody wants to go to the hospital. And nobody wants to have to go to a clinic and get medications for fear that they will meet someone who has coronavirus and then get infected. So we've been working a lot with just providing tools so that people can keep their bodies healthy and strong, not only now, but also with the knowledge that if there's a resurgence in September, they will be stronger and they will be less at risk than people who perhaps haven't been as prepared. I have found it actually interesting that, I guess it's just because people are really informed. Nobody has come to me, and obviously that's good because we don't have treatments for it, but nobody has come to me saying, I want to treat or prevent coronavirus. I want the medications for this. And it's good because we don't have any. There have been people out there claiming that X, Y, and Z treat coronavirus. 100% we know this for sure, and we also know that that's not true. We don't have a conclusive cure for COVID-19. We know that certain supplements and certain foods work because they have worked in other viruses, but we can't conclusively say that. So saying that, I've been working with people a lot on the correct nutraceuticals, diet, the right lifestyle choices, just to keep their bodies healthy and keep their immune systems really strong. The second one would be the mental health aspect, and anxiety levels absolutely skyrocketed when coronavirus hit, and especially when isolation and personal distancing became strong. Anxiety would be really big. People were very, very afraid of those around them, of what could happen, of their finances, of their jobs, of their grandparents in long-term care. That became very, very pronounced. And then of course there was depression, because being by yourself all the time, it's very numbing on the brain. And a lot of people stopped doing the things that were healthy because they were self-isolating. So for example, they didn't exercise anymore. They didn't go outside. They lived on whatever frozen meals were left in their freezer. And in a lot of cases, this led to a depletion of nutrients, decrease in endorphins, hormone levels going out. People weren't following their sleep patterns. And so that really needed addressing. And a lot of times it was little things that people could do to start to make themselves feel better, in terms of, diet and lifestyle, nutraceuticals. Those would be the two things that were the strongest, was immune health and mental health for sure.
I remember my first isolation. That was also the hardest part, where people, either if they were single or if they had a big family, because big family a lot of conflicts are
Yes.
coming up, and that's also can be a lot of anger.
Yeah.
It's not a depression, but it's a form of depression, because we are all fighting, and it's a lot of words and a lot of, it's emotional violence is there. But on the other side, the people who were alone and disconnected from others, they felt unseen, unsupported, left outside. So it was a lot of struggle on both sides.
I did see both sides, just like you're saying, those who had a little house and 3 kids, 2 parents, a dog. One of the kids has health issues, and they're all stuck in the house for 3 months. Yeah, and then of course, like you said, the single people.
Yes, single. That is, and it's always we put a lot of attention on seniors, but I remember I was a teenager in that isolation. Oh, younger people can also be affected because they don't have those coping mechanisms,
Right. Yeah.
and they don't have like life experiences, so they don't know how to put that in the perspective. Like, what is this? Is this going? There is, and they're impatient, so they want to solve the problem. They want to, especially nowadays when we have everything on click. So it is. I can't imagine. Assume that a lot of people were really in a bad situation. But let's go back. I'm interested in this immune system you just mentioned. It's about self-care. Everything you said, it's about actually self-care, and we know that the self-care is foundation for our well-being. But somehow we tend to forget that, or especially in this situation when we have financial and other issues, we tend to do things which can harm us, put us out of balance. So I would love to know, because naturopathy is related to every, as you said, like everything we can do every day without special medications, without special knowledge. So what are the simple things we can do every day which can keep us physically strong and emotionally grounded, balanced?
That's a great question, because you're right. It is the simple things, and it's something that these points are things that I've been educating people on for the past 9 years that I've been working here, and it's no less important now than it has been for those time. Physically, mentally, emotionally, keeping yourself healthy and strong is going to make you more resilient. And the number one thing, and also none of these are a surprise. You're going to hear this and you're going to say, I've heard this 100 times, and it's because that's how important it is. Number one is sleep. Sleep is so important. In times of isolation like this, and in times of upheaval of our work lives and our personal lives, you can end up staying up late watching a movie, and then you sleep in, and your sleep cycle gets completely off, or you're not sleeping enough, or you're napping a couple hours in the middle of the day, and then it throws off a lot of our hormones and neurotransmitters. Sleep is a time when we heal and we detoxify. Proper sleep is absolutely essential for health, and so that would be the first thing I would say, is you need to get back into proper
what would
routine.
you say, what is the amount of hours we have to?
Ideally 7 to 9.
Okay.
Ideally 7 to 9 hours of good restful sleep. So you don't want to be laying in bed tossing and turning, or watching a movie, or being woken up several times. If you can get into a pattern where you're getting some good restful sleep, and ideally before 10 o'clock or by 10 o'clock in the evening. Sleeping from midnight till 7 is not the same as sleeping from 10 till 5. It's really different, because it relates to our circadian rhythms.
Okay. And what is your opinion about naps?
Actually, I think that that's a really individual thing. I think that cat naps in the middle of the afternoon can be phenomenal for some people. They help refresh you. People sometimes just need a little bit of downtime for their minds, especially if they've got a very busy life. So a little mini 20-minute nap in the middle of the afternoon can be great, because you don't enter a deep sleep cycle when you do just 20 minutes. Okay. For some people, it doesn't work at all. And I say you just have to listen to your body and see what works for you.
Okay, sleep is the first one.
Yeah. Second one would absolutely be a healthy diet. So that's something else that falls down the wayside. You know, you don't want to go for groceries, so you've got a couple frozen dinners or frozen pizzas, or you just decide to keep ordering in. The fruit and vegetable intake goes down, healthy protein goes down. People start eating a lot of junk food because they're just sitting in front of the TV, or they're bored, or they're anxious, or they're feeding depression. Having the right diet so that you're getting the right vitamins and minerals feeds the brain, feeds the body, and keeps us healthy for our immune health, for our mental health, and for our physical health.
And what are the things we should have now on our plate? It's a springtime, so people can buy a lot of veggies, especially green ones. But what are the things we should have, or we were supposed to have on our plate?
So, you know, half your plate should be vegetables, right? Or some kind of produce, and ideally leafy greens being a big part of that. And one thing I really like to advise people when we're talking about the fruit and vegetables to eat is try and eat a rainbow every day. It doesn't have to be the full rainbow every day, but if you can, that's great. But, you know, get some of the purples, get some of the reds, get some of the greens, get some of the whites. They've all got different nutrients that our bodies absolutely require. You need to have adequate and healthy source of protein. So if you're a vegetarian, that means beans and legumes and quinoa. If you're a meat eater, then it's a good, healthy, grass-fed chicken or beef or venison or bison, and obviously seafood is phenomenal. And then good, healthy whole grains. You know, a small portion of whole grains, quinoa, rice, and healthy fats, of course. Those are the things that make up a healthy meal. Way too often we miss major food groups. Usually a big part of that is the fruit and vegetable food group or the protein food group. Is that. So if they can get all of those things as part of their meals and most meals of the day, you're already leaps and bounds ahead of a lot of people.
So just to say one more time, this is not only when it's coronavirus.
Oh, it's always. Absolutely, always. Yeah, it's just no less important now just because we're not working. It's probably more important now because now we have time to make good habits.
Yes.
When we're running around work and the spin class and taking the dog out and taking the kids to music lessons, and we don't have necessarily the time to make new habits. We just fall into those old ones. Now, or over the past couple months, we've had the time to go, you know what? Let's learn to cook a Thai meal.
Yes.
Right? I can order the ingredients, or I can go pick them up at the right time of day. I've got time to sit down and prepare. Let's learn to make healthy meals. So yes, it's not now, it's always.
Oh, amazing. Amazing. Okay, so let's move to number 3.
Number 3 would be exercise and fresh air. So like I said, being self-isolated inside is so detrimental to health. We are so phenomenally fortunate where I live here in Victoria, where we live in Victoria, BC, that it's, you know, it's except for today, it's lovely outside. You know, you can go outside, there's no snow on the ground, it's calm, it's safe. You can go for walks down trails and in parks that are open. That increases endorphin levels. It's good for our mental and physical health, helps to manage weight, just getting some vitamin D exposure, critical. There were a lot of people that I counseled through COVID who were extremely depressed. And I learned that some of them were spending every minute of the day inside their apartments. They hadn't gone out for 2 or 3 weeks at a time, and they were the ones experiencing the most serious health detriments. And so once I started counseling them, okay, just 20 minutes, go outside for 20 minutes, find an isolated area, 8 o'clock at night, there won't be as many people out that time or whatever. Every single person that I counseled for this reported improvements in their health.
Amazing. Yes.
Okay. I also found that people were very respectful of other people's spaces. So I have a dog, and so she had to go out for walks several times a day. And I'm lucky I live right on the Galloping Goose, which is a long trail that goes through Victoria. And there were lots of people out there, but you know, as soon as you came up to somebody, everyone kept their distance.
Yes.
And I found it so, I didn't feel at all stressed, even from day one, taking my dog for a walk, because people, almost every single person were very aware, and they were worried for themselves too, right? So everyone kept their distance.
Yes, they were very respectful, and
continue to be.
Yes. Is there anything else? We mentioned
I guess two more things. One would be focusing more on the more positive things in our lives, as opposed to only looking at how awful COVID is. It's actually a really there's in Victoria. Well, we have three major major crises going on right now, with a lot of negative news. And negative media going on. So if you so I find that focusing too much on all of this negativity in our world right now, and the fear that's going on, it's toxic. And so starting to, take news breaks, take weekends off of watching the news, and start to focus on those really positive things that we have, and looking to all the wonderful things that we have in our lives.
Yes,
it's really important right now.
Yes. I found that also in back then. Wanted to be informed. I wanted to be informed, but by doing that, I was sucked in, and all the negativity. I suddenly became hopeless and helpless, and nothing worked. And then my physical body was reacting, and I got sick. So right now, I'm like choosing what to read. Choosing what to watch.
The last one would just be that I would say it's a really important opportunity right now for us to step back and take stock of our lives. We have time now, right? Am I happy with my life? Am I happy with my job? Am I happy with the things that I'm doing? Am I happy with how busy I usually am? Now is a good time to be able to have time to sit down, either journal or just reflect. I have had so many clients who tell me that they're grateful for COVID, because it's made them step back and take some time for themselves, that we as a society don't do. We respect being really busy in our society, and it's time to respect having our time.
Yes, I agree. We are now rethinking about jobs. Schools are changing, jobs are changing, and our lives are changing I want to believe it's for better. Because once you start rethinking, you will do that decluttering. You will I don't want to say lose something, some maybe friendships or some habits, but you will gain new ones. You will make a room for new ones, and it's a big checkup. Like suddenly somebody put a pause button, and now we get an opportunity to do the restart.
Yes, good way to put that. Yes,
and I just hope everybody will use that for better.
Yes.
Not to go back. Okay, those are really simple things I just said. So we have to sleep. We have to sleep, but in this case, like, remind ourselves that we need those 7 to 9 hours of regular sleep, to walk, be on the fresh air if we can, whenever we can. So stay active, mind your food, mind your what you're taking, water as well, and
yes, of course.
Yes, and like stay healthy. So, this is like a mind practice, like
positive mindset.
Yes. Choose what you eat, but choose what you read, what you listen, what you
think.
Yes, what you think. Did you started anything new in this?
I wouldn't say that I started anything new, but I augmented certain things in my life that I had been doing minimally before. So I'm a big gardener, and so that's gotten a lot of time now. Right before COVID hit, I adopted a new horse. And so we've been doing a lot of training, because I don't have to socially distance or personally distance from my horse. He's a safe place to go to. I'm also a chocolatier, and so I've been doing a lot of that. It's getting a little bit too warm now, but so I've just increased some of the activities that I was doing before, and obviously decreased some of the ones that I wasn't allowed to do.
I want to hear, because you were treated a lot of different patients through this last 3 months, and you've heard many stories. So I want to know if you would like to summarize all those experiences into some message that we can send to someone out there, like anything. Is this for good, or what did you notice? So anything, if you can say.
Yeah,
words.
I guess the message that I would put out, that I've gotten the most from people, is to look at the bright side of what's happening right now and to take the benefits from it. I would say 90% of people that I have spoken to have felt blessed by some of the changes that have happened during COVID. The stepping back or the taking more time. And so I think it's a really good opportunity for us to rethink and to find the positives and how it's affected us in our lives.
Mm-hmm.
That would be the big thing that's come out of most of the interactions that I've had with people over the past few months, and as well just what I've noticed over the past couple of months.
Yeah, I found that a lot of people now know what is the good thing.
Yes.
But sometimes they lose a track with following those.
Yeah.
Like it's one thing to know what to do, but to really do it. How do you do that in your practice? How do you make people do?
Well, I can't make people do anything. But what I can help people with is something I like to ask people to do is, if there's something they really know they want done, is number one, to write it down. Mm-hmm. So actually writing something down in paper with a pen or pencil, not on your computer, helps solidify it in your mind, and seeing it written down can make you decide whether it actually looks real and looks honest to you. The second one is to tell a friend what it is you want to change, and then you can not only, you've put it out there in the world, but you can also get feedback on it. And if you write it down, it gives you the opportunity to start to take concrete steps, especially, like I said, now we have time. So now when you know that there's something you want to change, you've got it written down, you've told a friend, it's time to start making a plan to making those change, whether it be changing a job or starting an exercise routine or whatever. Find a support person. And if it's not a friend, find a practitioner who can help support you through it. Because there are a lot of us who are there to help a lot of you with those things that are bothering you. And whether it's a dietary issue, whether it's a stress issue, whether it's forming new habits. We are also health coaches, right? To a certain extent. And having support, I think, is the most important. Making it clear to yourself and then having support.
Do you want to maybe say something for the end? Anything else?
Yeah, sure. Well, thank you for having me. I'm really, it's very nice to be able to connect with you and connect with other people out there, whoever's going to end up seeing this. Yeah, like I said, I'm a naturopathic physician and registered acupuncturist. I work here in BC. Natasha, I think that you can put my website on there somewhere. I am accepting patients, and yeah, I really wish everyone the best in getting through this and moving forward. Wherever you are in the world, we are going to get through this. We're going to stick together, and it's not a time for major anxiety or for fear. It's a time for coming to ourselves and learning something new and having time for ourselves and our families.
Thank you for being here. I wish you the good day and hope to see you soon.